Welcome to our video on the measurement of blood pressure. Measuring blood pressure is a fundamental clinical procedure used to assess cardiovascular health and detect potential issues such as hypertension. Let's go through the step-by-step process for accurately measuring blood pressure. To measure blood pressure, follow these steps. Find the pulse on the patient's wrist to locate the brachial artery. Apply the blood pressure cuff snugly around the patient's upper arm, ensuring it is at heart level. Place the stethoscope with its base underneath the cuff at the brachial pulse site. Tighten and pump the cuff until you no longer feel the pulse. Note the pressure of the cuff at this point. This is the approximate systolic pressure. Next, proceed to inflate the cuff an additional 30 milligrams higher than the recorded pressure where the pulse was no longer felt. Slowly release the pressure in the cuff while listening through the stethoscope. The first sound you hear is the systolic value, indicating the pressure at which the heart can overcome the cuff pressure and begin to pump blood. Continue to slowly release the cuff pressure. The subsequent series of sounds you hear are known as Korotkoff sounds. The point at which these Korotkoff sounds disappear is the diastolic value, representing the pressure in the arteries when the heart is at rest between beats. Accurately measuring blood pressure involves careful attention to these sounds and pressure readings. The systolic value corresponds to the force of the heart's contraction, while the diastolic value reflects the pressure in the arteries when the heart is resting. Understanding how to measure blood pressure is essential for diagnosing and managing various cardiovascular conditions. Regular monitoring can help in the early detection of hypertension and other related health issues. Thank you for watching this video on the measurement of blood pressure. Stay tuned for more educational content on medical procedures and health assessments.